Top of the morning, Dan and Amy. I want to play the Joe Scarborough Everybody Knew game again. Joe Scarborough yesterday haranguing the president. I mean, you got to watch MSNBC a little bit to hear some of what's being said in certain quarters that represents a certain percentage of the population. Scarborough, in setting up his discussion with Dr. Zeke Emanuel, said this.
Nobody could have seen this coming. The fact is, everybody saw this coming. Everybody saw this coming in early January. So
everybody saw it coming.
Everybody knew.
Everybody knew. Everybody knew. But Joe Scarborough, he's would be included in everybody, and he didn't say or do anything. How could he not say or do anything if he knew?
How could he let this happen?
He has a platform. Yeah, I mean, should he be investigated for colluding with the Chinese communists? Because he obviously knew. He just said he knew, and he did nothing. What was he doing? Oh, right. He was flacking for congressional Democrats as they were in the middle of attempting to impeach and remove President Trump from office. But everybody knew. Here's the thing about Joe Scarborough. He's right, but not on his timeline. He's right on the timelines we've discussed on the show before. The 2004 report by the National Intelligence Center modeling out what a pandemic could do to America in comparison to its preparedness. He's right in terms of the post-H1N1 task force that call for the number of N95 masks that were used during that outbreak, 100 million, to be replenished in the national stockpile. He's right going back to the 90s, reports from various agencies. This is the investigative journalist work of John Solomon over Just the News, where you have various experts in relevant fields signaling the same warnings that were signaled in that 2004 report. And there was a good piece by Paul Miller from Georgetown on that report that we discussed. Randy Larsen, writing in National Review, makes the point as well. During the past several decades, many of my colleagues in the biosecurity and public health communities, plus a bipartisan group of political leaders, have argued to include public health as a key element in national security. Unfortunately, most national leaders fail to listen. He mentioned specifically a 2011 report on three key areas identified by senators. This is Bob Graham, formerly former senator of Florida, Jim Talent, former senator of Missouri, in the WMD Center report card in, 2011, the things that we should be doing. We didn't do them. So this is many presidential administrations, hundreds upon hundreds of members of Congress from both parties over generations. And the effort by these shameless historical revisionists to suggest everything that should or shouldn't have been done can all be concentrated from, January 1 to the present is obscene. And so don't play the Joe Scarborough game of just going tit for tat. Why didn't Obama replenish the N95 masks? Why didn't Trump take testing away from the CDC and energize the private sector sooner in February? Don't play the cheap shotting game. Play the historical context game, so that we just do the planning that's required now as we at the point at which we get through this, and then actually do the resource allocation to implement the planning on a go-forward basis for the next viral outbreak, because there will be a next one. For more on the topic, we're pleased to be joined by the author I was just citing, Randy Larsen, who's a retired Air Force colonel, former National Security Advisor at the Johns Hopkins Center for Health Security, host of the upcoming podcast series, A Good War, featuring stories of public health heroes, past and present. Randy, thanks for joining us. Appreciate it.
Dan, happy to be with you this morning.
I wanted to go to that 2011 report that you cited in your piece in National Review and sort of the three buckets of things that we should do per that report that we didn't do, at least not to the extent that we needed to.
Yeah, I'm happy to talk about that. I was the lead author of the report. Of course, Senator Graham, Senator Talent, a Democrat, a Republican, were our leaders. It was very bipartisan, and it's still sort of used as the gold standard. The problem is I think our serious leaders have not put us in a position to be prepared to respond. And that first one is the rapid diagnostics. I mean, that is step one. Now, I'm not a physician. I'm not a public health expert, but I've been at the Center of Health Security at Johns Hopkins there for 15 years, and my role is the National Security Advisor. And I look at this as a national security perspective, which I really enjoyed listening to your last guest, Josh. But we got to talk about this now because you have no situational awareness. That's what a general refers to on the battlefield. You got to know what's going on around you. We don't have that because we were so far behind in the testing. But things are changing on that is the good news. I have a relative who was ill, and they gave him the strep test, which is instant, practically instant. They gave him the flu test, no. So then they gave him the COVID-19 test, the early one, that CDC. 5 days later, we're still waiting for the results. That is just crazy. Now, they're getting in the field right now where we're going to have near real-time testing to see who's got the virus. That's going to be a big game changer. The other one was talked about yesterday in the White House press briefing is a test that will look for antibodies. Personally, that's the one I would like to have. I think I may have already had it. I was sick about 5 weeks ago. Not too bad, but certainly had some sort of viral infection. But if I could go get that simple test, and it's no more difficult than you take a blood test to see your blood level sugar, just a little stick in the finger. If we could find out that I have the antibodies of COVID-19, that means I don't have to sit around the house and just write articles. I could be standing at the front door of hospitals, checking people in, taking their temperatures, because I'd be safe.
Well, where are we on that?
Those are the two tests that are coming.
Where are we on that testing, Randy?
They're deploying, Amy, and next week, the week after, the question is, how quickly can we mass produce them? The technology has been approved by the FDA. They're being made. It's going to be a game changer during the month of April. I can't give you a hard timeline. I can say in the next 2 or 3 weeks, we're going to have so much more situational awareness, which is what our political leaders at the federal, state, and local level need to make informed decisions. Should we keep this city locked down? Well, when can we let a few people start going back to work? So maybe we can start saving the economy. And my heart goes out to so many people that are out of work right now. We got to figure out how to get it restarted, the economy, but we can't do that until we have the situational awareness. That's where we got behind the power curve. Second big point. Okay,
well, just hold on to that. So Dr. Birx yesterday at the briefing made mention of this, and she sort of put out a clarion call to universities to aid in the development of the antibody testing, the way that the private sector, the pharma companies have aided in the development of the COVID point of care diagnostic testing, like with Abbott now distributing their tests. And so, and she seemed to be like saying, like, by week's end, which is 48 hours, she seemed to really be pressing to get this online, as you're suggesting.
And then it was interesting when Dr. Fauci stepped up to the microphone and he said that's not our first priority. And I understand. Believe me, in a military situation, the top leaders have got to figure out what the priority is. I understand that Dr. Fauci doesn't want the antibody test to be the top priority, but boy, I hope it's really close second place, because both of those tests are needed, and they're coming from two different sources. So why game changer.
Yeah, why would you need to sequence them? Sequence them.
Yeah.
You could do them in parallel fashion.
I completely agree with you, and I'm not sure why Dr. Fauci said it wasn't our top priority. Why aren't both of them priorities? Because they're coming from different production methods, so and sources and organizations. So, like I say, I think that's critical. I'm not going to question Dr. Fauci, because right now he's the best thing we have in the U.S. government to protect our families. I'm telling you.
Well, as a military man and a former, professor and department chairman at the National War College, do you think we are overreacting with all these stay-in-shelter orders?
No.
And why not?
Simple answer. No. It's now if all the models say that's what we have to do. Now, being a military man, I will also say all models are wrong, but some are useful. And
Right.
and why most time we say models are wrong because, it's garbage in, garbage out. We got a lot of bad information early on from the Chinese, which is why I like your previous guest, Josh. And they have hurt a lot of people. And when we do the hot wash, when this is all over and go back and look at everything, it's going to be incredible about the damage done by them holding back all the information till January 21st, when they finally said, "Oh, this may go human to human." So yeah, we're behind, but we're catching up rapidly. Thankfully, for the might of Americans' private sector and getting them involved. I wrote a study in 2015 at Johns Hopkins called Jumpstart, and I talked about the Defense Production Act, and I said in a big crisis like this, the president has enormous power, how he can take over an industry and say, Johnson & Johnson, stop making, your anti-cholesterol drug and make this. The president can do wage and price controls under the Defense Production Act. It's an enormous amount of stuff that we spent time looking at. So I understand President Trump's been a little bit hesitant to really jump in with that, saying, well, we just want the private sector to volunteer to do this. And that's good until General Motors, I guess there were some problems with negotiation and whatever. President Trump just lost his patience finally and said, General Motors, you're going to do this, and here's the price. He has that authority under the Defense Production Act.
Yeah, but I got to tell you, I got to tell you, I know, with all due respect, people in their lanes and they get zero focused on the thing that they know how to address real well. But the political leader has to take into account all sorts of other opportunity costs that are being paid. And I just, I'm glad to see any politician exercise any restraint in these moments, because every incentive is to overreact, because in Tony Fauci's world, there's no such thing as an overreaction, and there's going to be no political consequences for overreaction. So you might as well. But in resisting the calls for nationalization of industry, or even the heavy arm of government telling GM what they're going to do, I'm glad to see that, because you know how power creeps. And you set precedents of governments coming in, our government coming in and nationalizing an industry, or being heavy-handed with industry that's otherwise being generally cooperative. Then it's very easy for politicians to define crises down and invoke these same powers where they're not legitimate.
Actually, President Harry Truman tried to do that.
And the Supreme Court stepped in.
It went to the Supreme Court, Youngstown Sheehan 2 versus Reynolds, and the Supreme Court said, Harry,
exactly.
we like you, but Korea is a police action. It's not a war. It's not a national crisis. So there is a check on the president's power. The Defense Production Act scares me. I agree with you, Dan. I don't like one person to have that much power, except in a national crisis. But his power can still be checked by the U.S. Supreme Court. And so,
yeah, fair enough.
And it's been done before. Okay, can we talk about the vaccines and therapeutics?
Please.
Really
Yes.
big game changer here.
And
I'm just telling you, as I wrote the article, it's frustrating, but forget about a vaccine for at least 18 months from now.
Ugh.
Right.
But
talk about antivirals.
A lot of great therapeutics. A lot of antivirals out there. The one they're talking about, hydroxychloroquine, I took it 51 years ago in Vietnam. Not a lot of side effects for a 19-year-old kid, but it's could be the game changer, but there's many others. We're also looking at monoclonal antibodies, where someone who's recovered from the disease draws some products out of their blood, use it for others. That's what we did before there were antibiotics. So there's many things that are really being tested at a very rapid pace. The one we're going to get the quickest is therapeutics, and that could be measured in months. By summer, we could have some significant things there. And surge capacity at the hospital. Now, I understand at your convention center in Chicago, they're building a 3,000-bed hospital. Did I get
Yep.
that correctly?
Mm-hmm.
They sure are.
Yeah, McCormick Place.
If you ask the Army Corps of Engineers to come to your city and build something like the hospital, they will do it. But the question we've been asking at the center at Johns Hopkins for years is, yes, people can build pop-up hospitals, but where are the pop-up doctors, nurses, and medical technicians?
Well,
They're
there's a
not
call
there.
for
We
them
don't
to
even
come
have
forward.
enough of them in our current hospitals. Go ahead, Amy.
No, what I'm saying, there's a call. Tired. If you want to get back in the game, we need nurses and doctors right now.
Yeah, it's a handful. I wrote a book in 2007 called Our Own Worst Enemy. A study we did in Texas showed that there were 40,000 nurses who were no longer working in nursing. You know, they got burned out for that, whatever, and they did other things, selling real estate, whatever. I thought that would be a great reserve corps. That's, you know, we could have a couple weekends a year where we did just a little training and organization, and a crisis, we could call them. Unfortunately, nothing like that exists. And yeah, you can ask for volunteers, and you'll get a few retirees coming back, perhaps. Oh, retirees, that's the age group like me who are most at risk of this. So I don't think you're going to man a 3,000-bed hospital. And now there's a big debate going on because the mayor of Los Angeles says that they want to have COVID patients come into those temporary facilities. New York has said no, but now they're questioning it. And I'm not sure about Chicago, whether it's just going to be for which one are you going to use there?
Well,
McCormick Place, not ICU. They said it's for people with mild to moderate COVID-19 symptoms.
Okay, so they are going to allow COVID patients in there. And, you know,
Yeah.
when they say mild, one of the strange things about this disease is that you can go from moderately sick and suddenly, in less than 48 hours, it's a spike to very severe. So
well, and
I'm just not sure what those hospitals are going to do.
Well, and going back to the personnel issue, this is a good point, and this is also something else that should be in the post-mortem of the outbreak. Regulations, the regulations that are being relaxed, regulations that are being relaxed at the state level, like Massachusetts Governor Baker did, allowing out-of-state doctors who aren't needed in their home states to come in and help in Massachusetts, because there are regulations that prohibit a doctor in Illinois from practicing medicine in Indiana, and those sorts of regulations that inhibit, rallying resources to the areas of crisis should be examined too.
Now, why haven't we fixed that, Dan? We had that problem in Katrina.
There you go.
When a busload of doctors came from Atlanta, Georgia to help them out, and they got turned around because of stupid laws like that. One of the other things that Dr. Eric Toner at our center at Johns Hopkins has been working on for a year, he's an ER doc, is reduce standards of care. So,
Right.
Let's say we bring in that retired nurse or a nurse that hasn't worked in 20 years. Now, we got to protect them, their liability or whatever, and said, well, is it okay to have a nurse that hadn't really practiced in a while? Well, I'll tell you what, if you're really sick and the choice of who's going to care for you is a nurse who hadn't worked in 20 years or me, you should be hopeful or thankful that you would be getting someone who was at least at one time trained to be a nurse. So we have to look at those reduced standards of care. And I was not aware that Massachusetts was going to have to take special action.
They did take special action. Yeah, exactly.
Wow.
No, I mean, it goes back to the thing again, all the lessons we haven't learned over the last several decades, despite all the reports and all the experience. It's very frustrating. So perhaps we'll learn them this time. Colonel Randy Larsen, a retired Air Force colonel, former National Security Advisor at the Johns Hopkins Center for Health Security, host of the upcoming podcast series, A Good War, featuring stories of public health heroes past and present. Colonel Larsen, thanks so much for joining us. Appreciate it.
Man, thank you guys. You guys do a great job.
Thank you.
So,
Take
we'll
care.
have you back soon. And he joined us on our turnkey.pro answer line.
Hear about the big stories of the day, then talk about them right here on Chicago's Morning Answer on AM 560. The Answer.
Napa Know-How.
Truth be told, Napa Know-How isn't just for DIYers. Napa Know-How is for anyone who cares to keep their ride in good condition. Because while there are 6,000 Napa Auto Parts stores for folks who can change a headlamp blindfolded, there are also over 17,000 Napa Auto Care centers for folks who'd rather trust a pro than pop the hood themselves. So whatever your skill level, Napa's got you covered. Do it yourself or have it done for you. That's Napa Know-How.
Napa Know-How.
How much money would you like to save just by doing something you're already doing? How about 40%? With Allstate, safe drivers can save 40% just by doing something they're already doing. Driving safe. That's right, 40% just by driving safe. Visit Allstate.com or call a local agent for a quote today and see just how much you can save when you drive safe with Allstate.
Not available in every state. Savings vary based on DriveWise and other safe driving discounts. Subject to terms, conditions, and availability. Allstate Fire and Casualty Insurance Company and affiliates, Northbrook, Illinois.
AM 560. The Answer.
Coming up on Chicago's Morning Answer.
President Trump says he'll take a call from Joe Biden if Biden wants to discuss the COVID-19 response. So the question becomes, how long after that call and the transcript is made public will articles of impeachment be drafted by Adam Schiff and Nancy Pelosi? We'll ask Jim Pinkerton that.